Move things around.
All right, we're here in Phoenix with Dr. Six, and he's had some really good results with Pain Relief Miracle. Good morning.
Good morning. Good morning.
So, can you tell us a little bit about your experience with the product?
Yes, when I first came into contact with the product, we get a lot of products that come in and out of my office, and I wanted to make sure that this was something that was going to help out a patient. So I asked if I could have a sample of it and try it in my office for, I think I've had it for about 3 or 4 weeks now. And what I wanted to do is work with an injury that I've worked with many times so I could get a better understanding of how effective this is going to be or how much it's going to change. And I used my primary lateral epicondylitis, or golfer. Some of them is called tennis elbow. If it's on the inside, it's called golfer's elbow or little league elbow. But those were kind of my fixed injuries that I know about what they take in normal time, and I knew what it was going to take to fix them. So I started out putting that on my patients, driving it in with my tissue work, so with some what we call active release technique. And I noticed that my patients got better in about half as much time. Usually an injury like that takes me anywhere from, I would probably say, 6 to 9 visits before I start to get really good relief. And I noticed that this was coming in 2 to 6 visits. I tried not to change my protocol other than I put a couple drops of this on. But where I was really impressed is I had a few patients come in with plantar fasciitis. Now, plantar fasciitis in my office, those things those are very huge variables. They can run anywhere from 2 weeks to 2 months. Some people get better right away, some people don't. But the last 2 patients that I had in, I put a few drops of that on my ultrasound head and drove it in with phonophoresis, which is just the way to drive it in through the skin. And those patients were getting better in a third of the time. So I was really pleased and excited to use it. I plan on continuing to use it in my office. If it helps my patients, it's definitely going to help me get referrals, and they love the fact that it doesn't really carry a really strong odor to it, and they feel it. They feel it very immediate. You know, within the next 2 or 3 days, they notice that there's been some type of change, and I love this stuff. And we'll continue to use it in this office as long as we get those results. Now, I have got the chance to put it on with electrical stimulation as well as a driver, and that seemed to work just as good, if not better, than just the thumb. So I have a spray and I have the droppers, and when it's a spray, I use it on some of my big muscles that I'm working on. And I've had a patient come in that I was working on his thigh with the spray, and he didn't tell me that he was having problems with his knee, and the medial part of his knee, the pain went away. So, and I don't know what it was that actually happened. I wasn't working on his knee. I don't know if that spray gets over and gets into the system and does everything. But, you know, that was one instance where it did in fact work, and it worked great. So I haven't had a problem yet.